As we settle into life in a pandemic, in a new year, very little comes as a surprise anymore. No questions can be asked too many times, and the answers can change by the day or even the hour. Because we're always learning new things about this virus. So as we get closer and closer to widespread vaccinations, we want to make sure that you feel prepared when it's your turn. Tonight, we're answering your questions about the vaccine, what we know, what we don't know, and what progress is being made right here in our community, and much, much more. As we work with each other for a brighter future ahead. We Together, a coronavirus discussion.
And thank you for joining us tonight for our special. I'm Molly Pat. Tonight I'm joined by Dr. Donepudi from Stormont, Vail, and Shawnee County Commissioner Kevin Cook. So thank you both so much for being here tonight. We have a lot to get to and our time really goes fast together. So I want to quickly give an update on the latest numbers and trends that we're seeing right this minute in Kansas. So first, a look at the numbers. More than 262,000 people in the state have tested positive since the pandemic started. 3,500 people in the state have died from the virus, and right now more than 776 people are in the hospital fighting the virus as well. And the state of Kansas is falling a few spots behind in the ranks for how quickly it's distributing its vaccines compared to other states, according to the CDC. Kansas right now comes in at 38th for the total amount of doses administered to people. In total, the state has administered over 97,000 vaccines. Now, even though the state has been given more than 263,000 vaccines, which puts the state in 37th for the amount that's been given to Kansas as a whole. So we want to get right to it. I'm going to start with Dr. Donepudi for this segment, and then we'll get back with Commissioner Cook in a minute here. So first, are you getting a clear instruction of what Stormont's role will look like for widespread vaccinations and when we'll be moving into that phase 2?
So that's a great question, and one that we're all waiting for an answer on with bated breath. We're all expecting to hear something more from KDHE this week. I think most of the regions of the state have made good progress through their phase 1 vaccinations for healthcare workers and long-term care staff and residents. I know that last Monday in our discussion with them, there were still some pockets of the state where there were still quite a few healthcare workers who had not received the opportunity for vaccination yet. They were not open today, so we weren't able to get an update today, but we are hearing through some sources that there may be an update coming later this week. And we have pressed for clarity on both the movement to phase 2 as well as the role we are expecting health systems to play in that.
Yeah, okay, so the timeline's soon to come. Now, we want to quickly go over the final distribution plan from this state. So there's 5 phases, so we want you to understand what we're talking about when we talk about phase 1, phase 2. So we're finishing out phase 1 right now, which vaccinates all healthcare workers, residents, or patients in long-term care facilities and critical workers. Phase 2 includes anyone 65 years and older, along with firefighters, police officers, grocery store employees, also K through 12 school staff, people who live or work in homeless shelters, childcare, emergency shelters, or correctional facilities are also in phase 2. As for phase 3, people who are 16 to 64 years old who have high-risk medical conditions like cancer, Down syndrome, type 2 diabetes, and pregnant patients are just a few there, along with workers involved in agriculture, utility, transportation, and water systems, and also communications. Then into phase 4 gets us into people 16 to 64 years old with other medical conditions like asthma or liver disease. And then phase 5 gets us to the rest of the population for everyone 16 and older, something a lot of people are waiting for. Now, Dr. Donepudi, Sally Lunsford wants to know, how will phase 2 vaccinations be organized? Will they be by age or alphabetically, for instance, or will the vaccinations be given on a first-come, first-served basis?
So it'll really depend on the amount of the allocations that we receive and whom is getting those. At this point, we're not quite sure if the entire allocations for the community in this next phase will be going to the health department, and then they will be coordinating with the health systems to help facilitate the vaccination of the community, or if there will actually be a separate allocation given to the health systems for the role that we're hoping the health systems will be granted to participate in this effort. So I think all of us are trying to strategize in terms of how we extend those invitations. Obviously, we're going to leverage every communication channel that we have to get the information to folks. I know Shawnee County has already updated their site with a web-based form to gather information regarding folks' interest in the vaccine for phase 2, those that are in phase 2 to submit their information so they can start to gather that. Given what challenges some other states have had where they've just simply cast the net open and folks are waiting overnight, 18 hours, driving hours away in order to get a chance at the vaccine, and then sometimes having to turn around and go home. We want to be a little bit more defined in how we tackle it, depending on the amount of allocation that we have in doing kind of a phased approach and work in that way. But I don't know at this point whether we'll manage that through region or through the health systems tackling their patient bases first. Those kinds of questions are still on the table.
Yeah, a lot of people are worried about, if you are in the older age group, you're going to go and, be around a bunch of people as well, and then maybe not even be allowed to get it. So are you guys going to be helping the county and the community with those vaccinations once it's widespread, even in the 2 different parts of the Stormont Vail Event Center that are now vaccination sites?
That is absolutely our intent and our desire. I mean, that's really why we stood up that effort in the first place. We could have handled our own team members and healthcare workers in a much more confined capacity. So it was really trying to exercise that muscle to be able to flex up to the larger volumes that we would have to move through to serve the community need.
Okay, and so Rhonda Story asks, how does one provide proof if they are an asthma patient or any other high-risk condition? So how will you be verifying that people are in the correct phase to get their shot?
That's a great question, Molly, and one we are struggling with and seeking direction from KDHE regarding what their expectations are. I think all of us are eager for that age-based designation for this next phase because it's a easy thing from an ID perspective to be able to validate and tackle, and we aren't spending as much overhead and effort in trying to make sure we have the right target population. So I know for us, if we are leveraging our systems to reach out to our own patients first, we have medical records that we can leverage to be able to identify the specific target groups. But from those presenting to any vaccinating facilities, it's a challenge to be able to visualize how that will be managed.
Absolutely. Well, another viewer question from Tanya Judd tonight. She asks, if I get the vaccine and it may help prevent me from getting COVID or at least keep the severity level lower, but can I still pick up the virus and carry it around and spread it to others?
Good question. And the official national position has been that we are still awaiting literature and information to make sure regarding the risk of being able to carry and transmit it to someone else. I think most of us are at a place where we're not thinking that that is a high likelihood and that you will be protected, and it's likely that you will not be transmitting it to others, but we don't have the literature to prove that yet. From a prevention perspective, or personal prevention perspective, both the Pfizer and Moderna vaccines and their studies prevented 100% of severe disease. So when you think about people who are hospitalized or really struggling and having these long-term consequences of disease, none of the people that were vaccinated saw that. Now, we report a 95% efficacy because about 5% of people still did get COVID, but it was a much, much milder disease. So you don't reach those levels of effectiveness in many vaccines. I mean, this really is very, very effective therapy.
And so I want to talk about preventing vaccines from going to waste then. So what if somebody who has signed up to get the vaccine, they don't show up, who gets their vaccine? Is there like a standby list that people can be on?
It's very challenging, especially when we were getting towards the end of phase 1 and most of the people who were interested in getting the vaccine had already gotten it. We were looking ahead to the next day's schedule and trying to pull folks who were willing to come in earlier so that we could avoid having any waste at the end of the day. Moderna has 10 doses per vial. Pfizer has 5, 6, 7, depending on the overfill there. And once you have pulled a dose from the vial, you have 6 hours before it goes bad. So, KDHE's direction has been, don't waste it, get it in anybody, but from a public management perspective and the frustration that people have if someone who's not in the eligible group is receiving the vaccine and managing that public messaging, we were trying really hard whenever possible to get it to somebody who was actually within that phase. We expect with phase 2, with it being a much broader net, that should be much easier, and we're talking through strategies to be able to plan for and manage that as best we can.
Yeah, definitely a balancing act there. Now, my last question in this segment, last week there was a breach in the private scheduling site that is only for healthcare workers right now to get a vaccine. Do you know if anybody who wasn't supposed to get one of them did get because of that?
We implemented procedures where we were calling all the patients that were scheduled the next day and letting them know and validating that they were indeed healthcare workers. We also implemented a process. We were asking for proof of employment by a healthcare organization. Now, all of that was put in place during Monday. So is it possible that someone slipped through in those very first appointments of the day? It's possible. We leveraged every best effort that we could to make sure that the appropriate folks were the ones that were there for the vaccine.
Definitely makes sense. All right, we're going to take a quick break here, but when we come back, we're going to talk with Shawnee County Commissioner Kevin Cook. We'll be right back.
We Together, a coronavirus discussion sponsored by Stormont Vail Health.
I wear my mask because life is precious. I want to protect the people I serve and the people I love.
Frontliners, essential employees, heroes. We've been called many things during this pandemic, but the truth is, we aren't your first line of defense. That title belongs to you, your neighbors, and your community. By wearing a mask, washing your hands, and social distancing, you can keep us safe. Care for others, so we can care for you. Stormont Vail Health, empowering you together.
COVID-19. Will I get it? Will I survive? COVID is scary, but there's one place you should always feel safe. At Stormont Vail Health, our hospital and clinics are taking every precaution to make sure you can still receive your routine and elective health care quickly and safely. Our emergency department with a level 2 trauma center is still the best place for emergent care. COVID-19 is scary, but receiving your health care shouldn't be.
KSNT News and the Jefferson Awards are honoring unsung heroes and communities all across Northeast Kansas. Every month we recognize deserving people who go beyond what is expected to help those in need.
It takes everyone to make this work.
I just started volunteering for stuff.
If you know someone who is making a difference, help us shine a light on their service. Go to ksnt.com to nominate them today.
The Jefferson Awards, sponsored by Azura Credit Union.
Welcome back to our coronavirus special discussion tonight, where our goal is to answer all the burning questions that you have about coronavirus. So answering those questions for us tonight is Dr. Donepudi from Topeka Stormont Vail Hospital and Shawnee County Commissioner Kevin Cook. In our first segment, we heard exclusively from Dr. Donepudi. So now we'll hear from her again in our next segment. We're going to direct our questions now to Commissioner Cook. So again, thank you for joining us tonight, and congratulations in your new role as chair of the County Commission as well.
Thank you very much. I'm very happy to be here and happy to be part of the conversation.
Yes. All right. So first question I want to get to tonight, Commissioner Cook, is about the recent vote to extend the health order in Shawnee County. So real quickly, here's a snapshot of the health order. It limits gatherings to 10 people or fewer. Bars and restaurants can only be open until 10 p.m. And we know that the order will now be in effect until January 29th. So you voted in favor of extending the order, but Commissioner Bill Rippon voted not to. Again, the vote still passed, but Rippon cited his concern for voting no over businesses not being able to last much longer without help under the current limitations. So what advice would you give to any business owners in the area struggling to get by?
Right now, we really need to market our small businesses, our local businesses. Just if you like a place, support it. Order to go, order gift cards, do anything you can to financially help this business. The Joint Economic Development Organization, JADO, is working on economic relief, but that will take time to put together and administer. That's not something that's going to roll out tomorrow. Something that you can do tonight is buy a gift card, make sure the business owners recognize that you appreciate them and you want to see them survive. So when we look at that health order was extended to the end of the month, another 2 weeks, for us to look to see what are the effects from the postseason holiday bump. Are we going to see a Christmas, New Year's increase, or is that number going to level off? This is going to be a real reflection of the community too. Are you still following those health orders? Keep your distance, wear your mask, wash your hands. Before we began, the doctor and I were talking about COVID fatigue. I mean, I think we're all feeling it. We're all tired. We just want to move on and make sure that it can be in our rearview mirror for 2020.
Yes, I think we all can agree with that one. So a viewer messaged us asking how somebody would fill out the recent survey that just went live for Shawnee County about those in phase 2 for the vaccine. But they want to know what somebody should do if they don't have a computer or smartphone to fill it out. Do you have any advice for them?
Sure. We do have some sites within the community that you can go to. I know that there are still places that are available that have computer access. If you do not have access to a computer, if that's not within your means or abilities, please do contact the Shawnee County Health Department. We will work with you to see if we can get the information put in to make sure that you are listed as a priority or a person who has an interest in being that phase 2. We are looking to identify people within our community that would be our phase 2 participants.
And so can only people who live in Shawnee County use the Stormont Vail Event Center vaccination site that's in Ag Hall? People from other communities can't come in and get their shot, or kind of what's that going to look like?
We're looking at the people that work within the Shawnee County. So you may actually reside in another county, but you work within Shawnee County. So we're working within that demographic. We're looking at the people that would be the most impacted by the community, and those do include those people that are working in our community.
And so do you think that, working with the hospital to get this up and running, are we ready to move into phase 2 as, when we get the go-ahead, phase 2 is ready to go, are we prepared to do that and start right away?
I think that we have to look at our demographics, that this is coming from the federal government, a federal response down to the state with the Kansas Department of Health and Environment. The Kansas State Department of Health and Environment then rolls it out to Shawnee County, and all the counties were in the same boat. We're working with the state, and we're coordinating with the state to move from phase 1 to phase 2. But this really is a coordinated effort from the federal, state, and local governments and how that gets rolled out. And so we're all working here in the same boat.
And so can you talk about why there are 2 different vaccination sites at the Stormont Vail Event Center for the county and the hospital kind of working out of?
I think that we're looking at 2 different demographics. We're working with 2 different bodies of people. And so working with the Stormont Vail Hospital and the Stormont Vail Event Center for the Shawnee County Health Department, looking at making sure that we can maximize, and if you are in one area but you need to be in another area, and where you need to be and how we can get that rolled out.
All right. Another question I know many people are curious about is when a new health director will be named in Shawnee County. So, of course, right now we have Dr. Dennis Cooley filling in as the interim health officer after Dr. Gianfranco Bazzino resigned last month. Dr. Cooley made it clear to us a couple weeks ago that he doesn't want to be the permanent health officer. So are there any possible candidates that you can share with us that you're looking at, and what qualities are you looking for in a health officer?
We are working very diligently. We're getting closer to making that final decision, but it would be premature for me to say that we've got it narrowed down to a person or persons or where we're at. But I would say that, with a very short period of time, we should be working towards making that final announcement.
And in the last couple of months, we've heard about dozens of health officers across the U.S. and here in Kansas resigning amidst all of the pressure surrounding coronavirus. So is that a factor that you're considering as we look for a new health officer, and is it something that concerns you to think about?
Absolutely. I think that you look at within your own health community, not just the health officer, the superintendents, your principals, your teachers, everybody who's involved. This is an area where no one is going to be happy. You're going to have one group of people who think you're moving too fast, another group of people who think you're moving too slow. And no matter what you do, somebody is not going to be happy with the response that's being delivered. And so it's a very tough position. And then on top of that, you have elected officials and the business community, and it's a whole dynamic of working for public health.
And so we touched on this earlier, but I want to circle back to the economy and business now. Because of the shutdowns, layoffs, and health orders, there's a big concern in the coming months and years on how it will impact and affect people in the communities that they live in. So is that something that you all are worried about right now for Shawnee County as a whole?
I think that what you look at is in Shawnee County, our trajectory was moving upward at the beginning of 2020. Things were really developing. You have really the downtown was coming to life, fruition, and then in March, the pandemic hits, everything gets put on hold. Is it going to rebound? Is it not? Is all of that effort and investment into the downtown going to yield the result, or is it going to be for naught? And I think that, that's something that we don't know the answer to, but it is on the tip of our tongues. It is on the front line of what we're looking at. We want a healthy business community. We want people to be working and living in Shawnee County. And as elected leaders, that's what our top priority is making sure that we have a place for people to work.
Yeah, again, it's that balancing act for sure. All right, we're going to take another quick break here, but before we go, we want to thank Commissioner Cook for joining us tonight and taking the time to answer all of our questions. But don't go anywhere, because we've got more answers to all of your burning coronavirus questions on the way.
We Together, a coronavirus discussion sponsored by Stormont Vail Health.